How does biomimetic dentistry differ from traditional dentistry? The simplest answer is this: how much of your natural tooth we're able to keep. When a tooth is damaged, the traditional approach often involves removing the weakened portion and placing a crown over what remains. In many situations, that's still the right solution. But I've met patients who ask, is there a way to fix this without shaving my whole tooth down? That's where biomimetic dentistry comes in. The goal is to preserve as much healthy tooth structure as possible. And instead of preparing the tooth for a full crown, we use bonded materials designed to mimic the way the natural enamel and dentin absorb pressure and flex when you chew. The idea is to rebuild the tooth in layers so that it behaves more like what it did before it was damaged. That doesn't mean one approach is always better than the other. It depends on the condition of your tooth and how much of that structure remains. As a prosthodontist, I look at the bigger picture, like how your teeth fit together, how forces are distributed, and what will provide the most predictable long-term outcome. Sometimes that's a crown, other times preserving more of your natural tooth to give a better long-term support. If you're wondering whether a more conservative approach makes sense for you, I'd love to talk to you about it in my office in Parker. We'll evaluate your tooth, your bite, and the level of damage, and discuss which approach gives you the most stable and predictable result. If you'd like that clarity before moving forward, you can schedule a consultation using the link below.